Greetings, students. This is Dr. Weaver, and I wanted to go ahead and create an orientation to Nursing 341, complex healthcare for you all. Typically, we do these orientations in class pretty much on the first day, but there's so much work for us to do in this course for this 8 weeks that I don't particularly want to take up a whole lot of time with housekeeping type of things. So I decided to just go ahead and take the time to create this orientation video. And hopefully you'll be able to look at it during the preview week or before the first day of class. And that way we can more or less bypass this part when we get in class and pretty much go straight to the material that you all need to learn in this course. So let's go ahead and delve into this this orientation, and again, that way we can just spend more time on the material that is really important for you to understand, so that you might be successful. So I'll be doing a series of sharing with you, and we'll go through different aspects of the course. And hopefully this won't be long, and that's the key also. You can also write down your questions and send me an email if there's something you need for me to make more clear. All right. Let's see. So let me, that's not what I want. So bear with me as I bring up what I need to discuss with you all. Let's see, that's not where I want to be. As I said, I will be sharing a series of parts of the course with you. So just bear with me. And by the way, again, I'm Dr. Weaver, and I've been a nurse for more than 25 years. Guess I need to get this part out of the way as well. Been a nurse for over 25 years. I have worked pretty much anything from, or everything from med surg, telemetry. Have worked in the intensive care unit mostly. I have worked at several area hospitals, pretty much almost all of them, to be honest with you. The last one I worked at was Mayo Hospital, and I was there for almost 20 years. I worked in the medical intensive care unit, but I also floated to many other different floors, in particular, the surgical intensive care unit, cancer units, orthopedic floors, progressive care units. So I worked pretty much all over, even the ED. I started off in an associated nursing degree program at FCCJ at the time. It was FCCJ. Now it's FSCJ. But I got my associate degree from there, and of course, I wanted to get my bachelor's degree, so I went ahead and finished up my AA degree at FCC. Well, actually, it had changed by that time to FSCJ, so I got my AA from FSCJ. Then I transferred to Jacksonville University, where I completed my bachelor's degree. A great program, by the way, kind of expensive, but a great program. And then I was actually going to do my master's in nursing education at Jacksonville University. Didn't particularly care for the curriculum at the time. I think they have revamped it at this time, but back then I didn't really particularly care for the curriculum. Number one, they didn't have what we call the three Ps, which is for advanced practice nurses. It's advanced pathophysiology, advanced health assessment, and also advanced pharmacology. They're the same courses that if one wanted to become a nurse practitioner, those are the core clinical courses that has to be taken. So as a part of my nursing education program, I wanted to take those courses because it would be certainly instrumental in helping me teach the things that I do as an instructor, or those topics, if you will. Um, Again, they were quite advanced, really challenging courses and whatnot. Because I mean, it's those clinical core courses that nurse practitioners need to take. So that makes it a whole lot more complicated on a whole other level. Anyway, so I was talking to someone that was in another program at USI, University of Southern Indiana. And well, after that discussion, I decided to peruse the website, and I fell in love with the curriculum, actually. I had everything that I needed for me to become a more effective nurse educator. So I applied for their program, got in, completed that program in nursing education. Decided at some point while in that program, while I was on a semester break because they weren't offering a class I needed, decided to apply for the Doctor of Nursing Practice program. And so I was able to get into that program, of course, and I completed that one as well. And here we are. So that's kind of my background. Like I said, I have a pretty extensive background in different areas. I even worked for insurance companies, Aetna as well as the Hartford. I did utilization review for Aetna insurance, and I also did short-term disability for the Hartford. So it's kind of varied background, but certainly very helpful in helping me to do my current job. Let's see. So where do we start? All right. I'm going to, oh yeah, that's what I want to do. Again, bear with me. Just need to get everything in place. And I'm going to share this desktop with you all. Let's see. I think this is the one I want. Yeah. And hopefully you guys can see that. Get rid of this. I better get rid of this before you all see it. That's some test results. All right. All right. So here I'm just showing my dashboard, and actually, let me move this other document over here. I just want to make sure I'm talking about, or that I talk about everything that I need to, make it a more comprehensive orientation, if you will. All right. All right, so here's the desktop, and I'm just going to go into one of the complex health courses here, in particular, the syllabus. And so here's just an introduction or biography of myself, pretty much what I just told you. All right, so this is NR341, Complex Adult Health. It is 4 credit hours. 3 of them are 3 of the 4 are theory related, and the other 1 credit hour is for clinical. And yes, you will be going to a clinical site, hopefully. They have been for the last several months. You will be on a med surg floor. Of course, this is for you as a 3rd-term student. I'm not sure if that's the 2nd semester, but anyway, but at least the 3rd year. So as far as a course description, adult patients with unstable, emergent, critical illnesses are the focus of this course. Students integrate nursing, technological and scientific knowledge with clinical judgment to potentiate optimal health with a diverse patient population. Students utilize comprehensive assessment techniques and advanced nursing skills and multiple nursing modalities to maximize optimal health. A variety of populations and settings are used in the experiential learning component of this course. And so one example I will give you as far as complex health. If you guys can remember, and I don't know if it was adult health 1 or 2, you probably, or you should have learned about diabetes. In fact, I know you did because I had to do a clinical for 325 last term, or this term I'm doing it. And we did discuss diabetes. So, all right, so when you look at diabetes, type 1 and type 2, you learn about, essentially, the patho and the etiology, the assessment or signs and symptoms. So you get a pretty general knowledge of diabetes. Where it becomes more complex is when we begin to, or when a patient begins to experience DKA, mostly for your type 1 diabetics, or non-ketoacidosis hyperosmolar syndrome for type 2 diabetes. Both of them are complications. They likely require patients be in the intensive care unit for close monitoring. So I won't get into all the details of that those particular complications, but just understand that those are the complications, very complex complications that those patients will experience. So that gives you an idea. Another one is, for example, you guys have learned about CVAs, cerebrovascular accidents, and with these patients, they're susceptible to increased intracranial pressure, something that we go into more extensively when you get into complex health, because that is a complex part of that disease process as well. So that just kind of gives you an idea. You'll pretty much feel like, and you will to a pretty good extent, be going over some of this information that you previously learned, but then with that added component of complexity when these disease processes really go awry. And so you'll learn the more complex part of it, the treatments and so forth and so on. Anyway, so the next part, this is your textbooks, and I won't read this whole thing to you at all, actually, but we're kind of just touch on some stuff here and there. These are your textbooks. You need to actually get this manual, APA manual. I would highly suggest it. It's not that expensive. This is the 7th edition. You will need it, especially when you do your RUA papers. There's also a nice example or sample paper on the OWL at Purdue, which I'm sure you guys probably already know about. They provide a nice APA sample paper example with a lot of comments off to the side, if you will. So take a look at that. Another thing I would highly encourage, because I know that just talking to several students, they don't seem to buy textbooks much, be that electronic or paperback or what have you. You need your textbook. I promise you, if you want to pass this class, it is going to be very important that you have your textbook. I teach extensively from the textbook, and it's just no way around it. Because one thing I do encourage is read, and read. The ATI booklet, it is just a supplement rather to the textbook, Lewis textbook. But you guys really need to purchase this textbook, and you need to read for this course. This will enable you to not only get through your ATI exams and other assessments, but also ultimately it will help you to pass your NCLEX exam. So please do not be negligent in not ordering these textbooks because they are essential. The ATI supplement is just that. It is just a supplement. It does not replace your textbook. I know it's a little pricey, but this is a book that you're going to have with you for a very long time. It will be very useful for you even after you're done with nursing school. And again, I'll say this probably again and again. I do encourage read, read, and read. You will increase your comprehension. It will give you much more details of these topics that we'll be discussing. It will improve your endurance as you're sitting down, taking these long, drawn-out tests, it seems. Um, it will just enhance your knowledge in ways that you don't realize. So please get your textbooks. The drug guide also is a very helpful resource, and you should go ahead and obtain that as well. This last day of instruction just talks about in the 8th week, that Saturday, that's actually the last day. And so uh, everything would be in full swing as usual. We don't, you know, not do anything, if you will. I mean, there's still quite a few assignments and other work that we must do to complete um, the term. Take a look at Chamberlain policies. Take a look at the clinical learning. You guys have access to this, so I will leave that to you. Don't want to bore you to death. These are the program outcomes for the Bachelor of Science in Nursing degree program. So just go ahead and take a look at these. There are a total of 8 of them. Um, and these are the course objectives. Please go ahead and take a look at the course objectives as well. There are 7 total. These are the key concepts that we will be um, going over this term. And there is, let's see, 10 of these. So just take a look at this information as well. Again, I'm not going to sit here and read all of this information to you. Um, all right, and these are the clinical learning competencies that I would like for you guys to also take a look at. There are a total of 8 of these that you need to take a look at. And let's see, and as far as student attestation, this is what I want you to complete. Around the first day of class, you need to complete the student attestation. So you will be reading your student handbook. Keep that handy dandy because if you want to know what your rights are and know the what the policies are and so forth, this is something that you really need to just keep handy and take a look at every now and then. Um, let's see, and this is the assignment summary. Now, this is for, let's see, I believe this is the one that is off the course that is offered during that July period. But then here is actually the one for um, the November, December course that you guys will be taking. So I want you to make sure you to look at the student clinical behaviors you need to, and also student expectations. Go ahead and print that information of these documents, sign and date them, and upload them back to the system. You will be taking a drug calc. Make sure you guys put in your practice before you take it because you want to take it once and be done with it. You don't want to be on the second try because the third try after that, then unfortunately you will not be able to continue in the program. This is done via Respondus lockdown browser and webcam. So anyway, be prepared, please. And of course, each week you will have a clinical learning assignment. When we go to clinical, we do SOAP-B notes. Subjective, objective, assessment, plan, and evaluation. And this is something you must do on at least one patient. I think the first week there should be a care plan that you have to do, and then subsequent weeks you just have to do SOAP notes. And there are examples that you will find in the files section um, of the course, which I will point out to you. And you also have to do a reflection daily as well. And so um, that's what you'll be doing weekly. Let's see. And of course, it will, there's actually another, let's see. All right, I'll show that to you when I get to it. But anyway, so you have various assignments that you have to do each week, and they are due before, I want to say 11:59 p.m. So look at the week to week. I won't sit here and go through each and every one. But of note, you have an examination one here in the fourth week, and it covers everything that we cover from week 1 through 3, I believe. And then you're going to have um, a final exam in week 8. Like I said, even in week 8, we will be still completing the work that we must for this term. One thing I need you guys to know is when you do your binders for the practice B here, let's see. Well, let me just say that your practice binders that you have to do, there's at least 2 of them for the term. They all have to be handwritten. So please remember that. Please do not turn in anything that is typed. I do believe they allowed you guys to do that before when the pandemic came about, and people didn't have access to printers and such as that. But now that we're coming back to campus, and you should have access to the printers on campus and whatever other resources, you should be able to do this fairly easily. And even then, students were able to still write out the the remediation work, and then they took pictures and also uploaded them. So it worked either way. You also have your RUA interdisciplinary paper that is due the 6th week. And you're basically just looking at a technology that is utilized in the intensive care unit, and that is relevant to what we will be studying for this term. So just take a look at that. Make sure you always do your end of course surveys. If you want change to come about, it's no different than the political system. We always talk about if you don't vote, then your voice won't be heard. And so same principle pretty much applies. All right, now take a look at the RUA assignment and the guidelines thereof. Take a look at the attendance policy. Please, I know that things happen, but there's a limited amount of clinical that you can make up. If I'm not mistaken, maybe only 1 clinical you can actually make up. And so please make sure you're at clinical. Clinical is typically from 6:30 a.m. to 7 p.m. And for the next term, this November, December term, there's going to be 6 clinical groups because you guys are a pretty large group. So please make sure you come to clinical so that you can fulfill your obligation. We also have 2. Let's see. No, we have simulations that you all will have to attend as well on campus, and the clinical instructor should facilitate or be there to help facilitate your SIM experience as well. Here we're looking at the assignment values and letter grades. Basically, there's 1,000 points total that a student can obtain, a total rather. And so then you have your core assignments here. The average must be at least 76% on the core assignments to pass the course, and before the supplemental assignments are actually added to it, to the overall grade. And so, as you can see, these are the point values, and this is what they weigh over here. This also tells you what all of your different assignments would be. Look at your practice B and the proctored a binder assignments, and they're worth quite a bit as well, 50 points. All right, so just take a look at that. Take a look at the supplemental assignments. And again, this should total out to be possible 1,000 points total. All right. And this is just some other information that you should read as far as your course assignments and examinations. So just take a look at that. I suppose some of this information is somewhat similar to other courses, and so you guys are probably well versed in what the expectations are. These are the letter grades, their point, and as far as a range, as well as their percentage points. So if you want an A, you have to have at least 940 to 1,000 points. And that range is from 94 to 100%. But you can also make an A minus with a point range or average of 920 to 939 with a percentage range of 92 to 93%. So just take a look at that. If anyone has any disability that we need to take into account when you take your assessments, you need to go ahead and make sure you have the proper documentation and make sure you notify these folks so that we can accommodate you accordingly. Now, as we go through the course, these are just several teaching or learning methods that we will employ. We have different assignments. We have case studies, discussions, experiential learning opportunities, group assignments. We also have lectures and so forth, and media presentations and what have you. So there's a variety of ways that we can bring forth the information. And here's the course schedule. Now, the thing about this, I've already revised this, and I've put in more information, which I will show you here momentarily. It's just a little more detailed. So we just took this information and put it in another grid, and we just supplied more information for you, dates and just more specifics, if you will. So, and just taking a look at this, you have your various chapter readings that you have to do. Yeah, so, and these are just the different assignments over here, and of course the weeks that they should be done. And so that would pretty much end the syllabus. Now, let's go into here quickly. Well, let's go into to files. I guess that's another good place to go. And so here you have your clinical documents and also your course documents. And for example, if you go into the clinical documents, there's your level 3 clinical learning evaluation that you have to do. This is the example of the SOAPy notes and the guidelines that you have to make sure your documentation looks similar. And this is an example of COPD that was provided as well. This is the clinical a student commitment to clinical behavior document, which you have to fill out, as I mentioned, along with I believe it's the clinical expectations, not clinical expectations. Let me, I'll show that to you once I go into the document. I'm still new here, so I'm still really trying to learn everything, if you will. And then you have your course documents. And so this is just various documents that you may want to look at. This is actually the revised schedule that I put in here, which actually, I put this in the modules, but I have it here as well. So we'll just look at it when I get to the modules. Now over here, once you go into the modules, you should, yeah. So you'll see here the student attestation. So make sure you complete that. And this is what we have for week to week as far as what we are expected to do. Let's see, for Let's see, where is it? Yeah, so you have the student expectations here, and you have the student commitment to clinical behaviors here. And so this is what I was talking about. It has to be completed. All right. And then, of course, you have your medication calculation exam that is due also in that first week. You get 3 opportunities, but let's shoot for one. Uh, Now, one thing I want to tell you guys is whenever we are studying a particular topic within a week, make sure you go into these different weekly links here, because it does provide you with a rather brief overview of what we're going to be discussing. At the very least, if you cannot read before class, fully read the assigned chapters, at least now I don't encourage skimming. I only encourage skimming if you're getting ready to have a lecture or some learning activity, and that you kind of just skim through the information initially that we'll be discussing. And then, of course, when you come to class, there would be some kind of familiarity with the information. Um, but the weekly links here, it will provide some overview of the information that we will be going over. So do that weekly, week 1, 2, 3, all the way to week 7, I believe, maybe even 8. But just make sure you go through them. For example, if you go into, especially the Explorer, and it just gives you an overview of sedated patients and pain management and so forth. So just really great information for you. All right, let me go back. I thought I was going back to where I was. And yes, I am. So make sure you look at that information. Now, what I wanted to actually show you, and I may have to reshare again. Again, the same thing. We'll be looking at, for example, respiratory, and then you want to go into the Explore section in particular, and just take a look at what information it contains, because it will be helpful for the discussion that we'll have. Same thing with the rhythm matters when we go into cardiac. Take a look at that information, especially again in the Explore link here. Now, what I wanted to show you, let me see if I can get to it. All the way at the bottom is where I start adding some of my own class information, and you will rather appreciate this, actually. All right, so we'll go into the schedule, and I'll show you guys that. But right here is where I start um, providing PowerPoints that you'll need that contains a wealth of information, which I'll show you, um, and also voiceovers. Sometimes I have both voiceovers and PowerPoints of the same topic, and so some people may want to read it, some people may want to listen to it and read it, or some people may just want to just listen to the voiceover. So it just depends on where you are, what you desire to do, what your preference is. Let's see if I can give you an example. Well, let's see. All right. So, for example, here, now let me do this one. Nope, let me do this one. Sorry. So pain management. Let's see. So pain management. So when you go into, I'm not sure if I think I'll be able to do it here. If you go into the PowerPoints here, right? Now I really need you guys to really hone in on what I'm getting ready to show you here, because what happens sometimes, you see my notes in this section, in the notes section of the PowerPoint. I've had situations where it was pulled all the way down, and students, the only thing they were doing was reading just the slides itself, but they weren't reading the information in the slides, the notes in the slides. So just make sure, and I hope you can see this, just make sure as you read each slide that you read the corresponding information in the PowerPoint notes. All right, you see my notes here. All right. This is really great information for you all. It will certainly prepare you for what you need. So again, these are the PowerPoints. I have these actually uploaded in Google Slide, but it should be in read only. So again, just take a look at that. Let's see. This is, let's see, the critical care. This is basically the critical care PowerPoint. And so if you click on this link, this is, now, something I should have said also, this information actually comes from another textbook, but I still want you to read your textbook. The reason so is because when I first got here, I didn't have a whole lot of time to really prepare much in the way of PowerPoints. And so, but the information is pretty much the same, whether you read from a textbook from another academic institution versus the one you have here. I mean, you can't necessarily refer to the charts and tables and such as that I may provide on these slides. But if you read your textbooks, it should provide, information that is quite similar. But anyway, so this would be what your the critical care objectives would look like, and of course, it's corresponding information in the notes section here. And so, as you scroll down, you'll see more of the notes that appertains to this information. And see, so just make sure you're looking in both the slides and the notes is what I'm trying to show you. Let's see, let me go back. And I tried to do this weekly, all right? And so for week 1, this is all your PowerPoints. I think I'm gonna take out, there's something in here that I need to take out. I have to look at the schedule again, so I can know which one that you don't quite need at the moment. Now, this is one I just did on the general anesthesia and adjuncts to general anesthesia, but you guys have probably touched on a little here and there. And so this is, or rather, these are the slides that pertains to it. And this particular presentation isn't very long, actually. But I thought to make it a little easier for you by putting it all in one place. And these are just some questions. So just make sure you take a look at or listen to the voiceovers. For some of you who live in, let's say, these faraway places like Georgia, perhaps Orlando, Daytona, or wherever you live, or if you even live in Jacksonville, but yet you're sitting in traffic for hours, you can actually pull these up and listen as you drive. I mean, who wants to listen to me while you drive, right? But it just makes it makes your lives a whole lot easier. And so you're in nursing school now. Life is over as you know it. Seriously, it's just over as you know it. Not the end of the world, so to speak, but it's just over as you know it. You just have to put in the hard work now. Much of your awakening and sleeping hours will be devoted to nursing. I have to say, it's a lot, but you can do it. But you just have to put in the time. You have to you have to spend time with it. You have to put some time into it. You have to read. You have to read, folks. There's just no way around it. So anyway, this is week 1. This is week 2. See what we're learning in week 2. They even have a voiceover on electrolytes here. Let's see. Show you what that more or less looks like. So it's on the YouTube channel, and so here we are here. Unfortunately, this is a 3-hour and 30-minute lecture because it's a lot. However, you don't have to sit down and listen for the whole 3 hours and 34 minutes. you listen to it a half hour here, 45 minutes there until you get through the presentation. And much of this you guys have already learned anyway. So if you know it well already and you feel confident, perhaps you don't have to go through this. But if you need that refresher, and there's nothing wrong with a refresher, then my advice is to listen to the lectures a little bit here, a little bit there. Now, that's fluent in electrolyte. That's the voiceover, and I do put the word voiceover or VO in the presentation. This is the PowerPoint itself. All right. So, like I was telling you, there are PowerPoints and there are voiceovers for that PowerPoint as well. And so this is what this information looks like. It's quite a bit of information. I mean, fluid in electrolytes is not a it's a lot. It's a lot. So you can take a look at this information as well. Let's see. So that pretty much explains, for the most part, as I said, I do it weekly. Let's see. This is actually one even on the heart failure voiceover, which we'll discuss. I'll probably be discussing heart failure in class, even though there's a voiceover, because I like to do a lot of drawing. And this actually starts at the compensatory mechanism slide. So sometimes, of course, because we don't have a whole lot of time, guys. And so what I try to do is I go over as much of the information in class, and then whatever we can get to, then at least you have a voiceover as well as PowerPoints to take a look at. So just trying to use our time as wisely as possible. But let me tell you guys something. So my methodology is to not come to class and sound like a machine gun, just rattling off information, and you guys are looking at me like a deer, like the eyes of a deer, and when they see the headlights and whatnot. Anyway, so I don't want to just rattle off information, and you guys are looking at me like you just don't understand what I just said. I'm much more slower, more methodical. I try to go over it in a way that I want to make sure I'm bringing you along as we go through the material. Instead of leaving you behind, I want to bring everybody along the way, and so that you get a much more clear understanding of the material, because I want you to comprehend it. I don't want you doing a lot of memorization. Some things you have to memorize, like labs and such as that. But when it comes to this information, if you want it to stay with you sort of kind of forever, understanding it is much better than trying to memorize the information. So I want to see if I can do away with that bad habit of memorizing every single thing. There is too much information. Our discipline is heavily laden with information, and research is being done all the time. It's just too much. And so if you can just develop the attitude that you're going to understand how heart failure works, so to speak, then it'll stay with you, and you don't have to worry about just learning it for the test, dumping it, and then when you see this information again on an ATI assessment or an instructor's assessment or even NCLEX, you won't be looking, like, what the heck? All right, so I want to be able to get you to the place where you understand, and you hold on to that. So this is week 4. This is week 5. I don't think you will need CKD, so I think you will. I think you will. I think that's part of it as well. But there's a voiceover. I provided that voiceover actually when I had COVID, so hopefully you understand the voiceover well enough. Yes, I had COVID. I think my son gave it to me, but at any rate, I try to do the best I could with that one as well. And so it goes through all the way, through week 7. And I also created several voiceovers for nutrition, GI, and endocrine PowerPoints here as well. As you can see here, going into the link. I will tell you, it's about probably 70 slides altogether. But again, it covers all these different topics, the nutrition, GI, endocrine, and so forth. So it does cover quite a bit. All right. I don't know why that's seemed to be short. I thought it was, well, let's see, actually, um, this may be it, but I don't think this is I don't think this is a voice. Well, it is a voiceover. All right. Well, this is where I did a voiceover, but there's another one I did. I actually did a PowerPoint for this one, and so I need to excuse me, you all. I have something. Whatever type of tube that is being used. Kind of flying in here. But yeah, there's a PowerPoint I need to upload, and I thought I did already, and apparently I didn't. So I'll go ahead and search for that later. Anyway, so let's go back up to the schedule. This is the revised course schedule. That is in your syllabus, but this is the new and improved version, if you will. So when you go into it, let's see if I can, maybe I can expand this a little more. Yeah. All right. So I'm still sharing. This is the course. It's actually November, December, but since you'll be starting in October, I decided to just say October. This is your week. You know, the first week, and this is the first day of the week, which is Monday, October 25th. And these dates you see here are all Mondays. So as you can see, for example, November 1st and November 8th, these are all on a Monday of each week. All right. Um, these are the readings that I talked about that you have to do, and I have PowerPoints and so forth for each of these. Also, the key concepts that we will be taking a look at. Now, here is the assignments. They're due by Sunday, 11:59 p.m. This is a medication calculation competency exam, and we start this on the first day of class using a virtual, well, if we're virtual, but you guys will be on campus, I'm pretty sure. These are the different assignments that are due for that week. And I'll also, well, it'll be kind of difficult to do tutoring on the days that I'll have class because I actually have two classes on Tuesday and Thursday. So on Tuesday and Thursday, I'll be there from 8 until about 11. Then there's a break for me for about maybe a couple of hours, if that long. Then I have to go into teaching the other group in the afternoon. So we have to find another day to do some tutoring on if need be. And so if you look at each week, and I won't read this word for word because I know your time is valuable, but these are just the exams that you need to, the ATI exams or assignments. The quiz would be, this quiz will cover week one's content, all right? And it will be administered at some point during the class. And again, all this continues to be similar. The week, the course outcomes, your different readings, your key concepts that we will be looking at, and also the assignments here, as I mentioned. And of course, quiz 2 will cover weeks 1 and 2 content. Actually, right now, I just have it covering, for example, in week 3, this would be over week 2's content. And hopefully I'll be able to get to including both weeks 1 and 2 in one exam. There's so much information and so little questions that I can ask you on the quiz because the quizzes are like 20 questions apiece. You have 5 of them total. So total they're worth 100 points, but only 20 per quiz, 20 questions per quiz. All right, and then you have this is your first exam. It covers weeks 1 through 3, which will be done the first hour of the first day of class. And so this is what we'll be doing, you know, in the 4th week for your exam 1. And you'll also have your quiz. Quiz will probably be maybe, let's say, on a Thursday. This will be probably on that Tuesday, and the exam and the quiz will probably be that Thursday. So what you're studying for pretty much for exam 1 is similarly what you'll be studying for quiz 3. It's pretty much the same information anyway. So and so forth and so on. So just make sure you read each week and its corresponding assignments, and when they're due, make sure they're due on time. This is your RUA paper. It is a paper that should be 4 to 5 pages long, I believe, or 5 or 6. But do not go over the page limit. You have to be concise. You must be parsimonious. You must be stingy with your words and not elaborate on and on and on and on and on, because then people will say you don't know what you're talking about. So make sure you stay with the page limit, know what you're talking about, just be concise, and just get to the point. More about that later. Anyhow, so again, take a continued look at this information. Week 8 will be your exam 2. I may have to revise some of this, but so hopefully it will be straight by the time I talk to you when we see each other. Let's see. I might make this later. This is something I think I have to revise, that binder, because what I don't like is for students to spend a whole lot of time with binders when they need to be studying for their final exam. So I might make that due on a Friday before midnight. And so that should help you guys out so you can focus more on the final exam. All right, so that's the revised embedded schedule. And remember, it's in the modules down towards the bottom with all the PowerPoints and voiceovers and so forth. All right, so let me see if I'm looking over here on my other screen just to make sure I covered just about everything. So that's, so I did that one. Talked about the drug calculation, the syllabus, the student attestation, the revised schedule, the assignments and quizzes, the binders must be handwritten. I talked about the exams. The exams, I will provide a focus sheet that should help you to hone in on what you need to know for the exam. So don't stress out about that. I'll do that also for the quizzes. I talked about the time assignments are due, the RUA paper. All right, and we'll be talking more about APA as well with respect to that. For example, when you write your first paragraph, when you begin the body of the paper, people have a tendency of using the header introduction. No, it's not introduction. It is the title of the paper that goes over the first paragraph, not introduction. Please don't do that. I'm telling you that right now. That way, when I tell you again, hopefully it'll stick. Even in the APA manual, it'll show you the same thing. You don't use the word introduction. We know it's the introduction because it's the first paragraph. Just like we know that the last paragraph is the conclusion, and so you don't have to use a header conclusion and then write in the paragraph itself. You don't have to say in conclusion. We know it's the conclusion because you already mentioned it as far as the header is concerned. But enough about that. Also, I wanted to show you this. Let me close out of this. So if you go into the, let's see, I think it's Media Gallery. And I think I've already put this in the modules, but if you wanted to go into the Media Gallery, I also did, let's see, oh, maybe not that one. Maybe My Media. I hope this information pulled over. Oh, yeah, it did. So this is the clip on critical care and strokes. There's, I think, a part five. There are 5 parts to critical care. That's because I broke them up. They range from maybe 30 minutes to 45 minutes or so. Well, this one is 51 minutes, but I had to break them up, and that just got kind of cumbersome. This is the end of life one here. This is the pain management. But like I said, I believe many of these are already in the modules itself. So this is the one for strokes here as well. All right, so you can just take a look at that when you get a chance. Let's see. Oh, really important, guys. I really need you to listen to this. Get in the habit, and this is a bad habit for many of us, even for us as instructors, believe it or not. or I think just people in general, you have to read your announcement. You have to read the announcements. You must read your emails. Get in the habit of looking at your emails in the morning and also in the evening. That is my main method of communication with you, and you have to be able to know what is going on, what is expected of you, and that is the quickest way I can distribute. Disseminate information to a larger group. So please, please, please read the emails, read the announcements at least twice during the day. Let's see. I told you about pre-reading. I showed you the schedule. I showed you the voiceovers and the PowerPoints. Again, I need you to sign the student expectations and clinical behaviors, as well as do the attestation, week 1. So you got that. Can't believe I actually covered all this already. And I talked about the file, this file, a link here, and what can be found there as well. So so I think I did all right in covering mostly everything. One thing I again want to stress to you all is you have to read. I want you guys to be successful in not only making it through this nursing program, but I want you to pass your NCLEX exam on the first try. You don't want to create those kind of problems or anxiety for yourself. You want to, and this also prepares you for your exit exam as well. I know you'll say that you don't have time to read, but can you imagine? Can you just think about what you're saying? You are in a registered nursing program. You're not in a nursing assistant or tech or some program that doesn't really require much in the way of critical thinking, clinical judgment, reasoning, and so forth. You are in a program that is going to require your undivided attention. And so you are going to have to read, read, and read. Perhaps I'll tell you about some of my experiences at some of the other schools I've taught, where the students did not want to read and their scores were quite low. It reflected that. And until we really began to encourage some reading, the HESI scores just shot through the roof. That's just an abbreviated version of it, but it does work. I promise you. I wouldn't steer you wrong, not purposely at least. But I do know that the reading really helps a lot. I know you're probably saying, well, I don't understand this stuff when I read it. Well, read it again. I can't tell you how many times I read a chapter in microbiology many years ago. I mean, this stuff was like Greek to me. But I did read, and if I didn't understand it, I would read it again, and unfortunately, sometimes again. And I know you have jobs, you're working, and time is, you have families, kids, husbands, and so I know the challenges, but you've got to dedicate yourself to this. I mean, look, it's not forever. It's not forever. So you want to dedicate the time now so that you can reap the rewards thereafter. I mean, not only is it great serving other human beings, but even from a financial perspective, this can put you on a map. It can make your lives so much easier. And I can tell you about some of those personal experiences as well. I cannot think of anything else at the moment, so I think I will go ahead and sign off here, and I will get this link to you all at the appropriate time. Obviously not now because you're still taking your current classes. But as we get close, particularly close to preview week, I'll make sure you guys have this link. And hopefully you'll take the time and take a listen. And if you have any questions, just go ahead and shoot me an email, and I'll answer your question as best I can. I think that's about it, and I do appreciate your time and giving us here at Concord an opportunity to provide your academic needs. And at this time, I'm going to sign off. Thank you.